Assessment and interventions relating to handwriting form a significant portion of the caseload of occupational therapists working with children. Despite this, there remains considerable variation in both diagnostic patterns and the terminology being applied to the handwriting difficulties. There is also a lack of clarity in relation to who is responsible for the diagnostic practice and within which domains of practice it falls. Due to the multifaceted nature of written expression, drawing on skills from cognition, motor and linguistics, it falls within the realm of several areas of professional practice. The OT literature emphasises the importance of assessing both the process and the product of handwriting. So what does the research tell us about the incidence of handwriting difficulties? A study in 2007 by Mays and Calhoun found that despite people believing that a reading disability is the most prevalent type of learning disability, that a disability in written expression is more common. They administered the Whisk and the Wyatt to 485 children, 65% of whom were found to have a learning difficulty. Writing problems have long been neglected in learning disability research and epidemiological studies with clinical children, commonly assessing only reading and math or reading, math and spelling, while omitting compositional writing skills. The most common difficulty found was written expression at 92% of the sample, either alone for 50% of the children or in combination with reading and or math, another 42% of children. Only 4% of the children had difficulties in reading alone and 4% had difficulties in math alone. Children with writing problems had far more difficulty with the compositional skills of writing, that is, the linguistic and the organisational nature of writing, than spelling itself. There was no specific mention of the motoric aspect of writing. When studies actually evaluate writing skills and not simply spelling, the prevalence of learning difficulties in written expression in clinical children is actually greater than the learning difficulty in reading or math. 8% of the children were found to have difficulty with written expression but not spelling. This is an interesting finding for us here in Ireland, as it has implications for schemes such as the RACE scheme. For this scheme, you must have difficulties with both speed and spelling to qualify for assistance. Yet this study found that 8% of the children had difficulties with their written expression but not spelling. A study in 2011 found that up to 27% of school-aged children experienced difficulties with handwriting. Another study in 2016 found that the prevalence for writing disorders is about 7 to 15%, with boys being more affected than girls. Prunty and Barnett in 2017 assessed children with dysgraphia, developmental coordination disorder, and children with no difficulties at all. They found no significant differences between the handwriting of children with dysgraphia and DCD diagnoses, but that both of them performed much less well than the children without any difficulties. They found significant relationships between spelling, vocabulary, and manual dexterity with some of their handwriting measures. While no significant correlations was found with reading, it must be noted that none of their sample had a diagnosis of dyslexia. The children with DCD and dysgraphia had similar handwriting difficulties, whereas the children with dysgraphia had no underlying motor impairment. Individual differences in the type and severity of handwriting impairments suggest the need for a range of classroom assessments to tailor intervention appropriately. No one assessment was able to capture every child with a handwriting difficulty, so in research and in clinical practice, a range of measures needs to be included to more fully understand the specifics of handwriting difficulties. Another study by McCluskey and Rapp in 2017 found that we don't have a comprehensive theory of the processes implicated in the development of writing skills. Consequently, we should not expect the disruption to the writing system to be the same in everyone suffering from a developmental handwriting difficulty. To the contrary, they should be diverse. The goal should be to characterise the full constellation of proximal and distal causes on handwriting. We must study participants individually, allowing commonalities and differences across individuals to emerge from conclusion of investigations, rather than being assumed a priori as a result of some diagnostic criteria. As OTs, our expert knowledge regarding performance components should make us key players in diagnosing why the child is having the difficulties with handwriting that they are having. Research on acquired dysgraphia in adults shows difficulties with orthographic long-term memory, sublexical sound-to-spelling conversion, orthographic working memory, and graphic motor plans. During the writing process, visual feedback plays a significant role, not only ensuring appropriate orientation and spacing of letters and words across the page, but also in monitoring and controlling the shapes of individual letters. A fact sheet from the International Dyslexia Association states that some causes of handwriting difficulties can be poor fine motor skills, a tremor, some difficulties with phoneme to grapheme translation, that is, translating the sound that we hear to a symbol on the page, and also lexicon to grapheme translation, that is, translating the word in our head to the written word on the page. Graham, Weintraub and Berninger in 1998 suggest that a difficulty in the mastery of the mechanical aspects of writing may interfere with the higher order processes required for the composition of text. Handwriting is a complex occupational task with many performance components such as fine motor control, bilateral integration, visual motor integration, motor planning, in-hand manipulation, proprioception, vision, sustained attention, and awareness of fingers. There is evidence to indicate that handwriting difficulties do not resolve without intervention and affect between 10 and 30% of school-aged children. We need to identify the underlying performance components that are difficult for a child with handwriting disorder as a means of targeting effective intervention strategies. The achievement of automaticity in alphabet writing is a lower order skill that may be affected by 3 neuropsychological variables. That is, the child's ability to retrieve the letter from visual memory, their visual motor integration, and their ability to perform imitative finger movements and finger differentiation and opposition. They then need cognitive linguistic skills for higher order writing in planning and revising. Rosenblum and Dror in 2016 said the functional limitation for a handwriting problem is in relation to speed and/or legibility. No studies to date have considered the pain that children experience when writing. Many children with mild handwriting difficulties go undiagnosed, especially if they're from a lower socioeconomic status. Despite technological development, handwriting is still required for self-expression, communication, and academic skills. The child requires simultaneous activation of sensory motor and cognitive skills. That is, they need to formulate an idea, plan the syntax and spelling, achieve motor orthographic integration, and evaluate the outcome. Technology only helps from the syntax step onwards. It doesn't necessarily aid us if we have difficulties with linguistics. In 1991, Van Galen proposed this model for handwriting. He shows that handwriting involves cognitive, psychomotor, and biophysical processes. In his model, each process has a unit of processing. There is a complex relation of phoneme, which is sounds, to grapheme, which is the look, and non-phonological spelling prescriptions. There are also different allographic forms for upper and lower case. That is, a different look of the letter. There are a variety of writing modes, for example, print and cursive. Delicate manipulation of the pencil is required with specific orientation and size at specific positions on the page. As you can see from the slide on the screen, the first 4 steps of handwriting are related to cognitive linguistic mechanisms. For example, forming an idea, getting our concepts together, turning those into phrases, and working out which words we need to use to make our phrase. The latter 3 steps involve perceptual-motor skills. That is, turning the ideas that we have in our head into the look on the page, and then motorically presenting them. These pictures, also from McCluskey and Rapp in 2017, follow a similar theory of the handwriting process. This shows us that the lexical route, that is, working out using phonological long-term memory, the look of the word cat. Also, there's the sublexical route. Either way, regardless of whether we're doing phoneme to grapheme translation or going on visual memory of the look of the word, our orthographic working memory helps us to realise cat is C-A-T. From this, we have to break down each individual letter. Once we have the idea in our head of the letters C-A-T, we then need to work out what those letters look like and what are the graphic motor plans we need to use to write each individual letter C-A-T. A clue to a solution in handwriting difficulties came from Dr. Virginia Berninger, who found that 3 cognitive processes account for most learning difficulties in literacy. The first stage of this is known to have difficulties with orthographics. Orthographic is a Greek word meaning letter forms in written words. Receptive orthographic coding helps us to read and spell words. We have to sequentially encode or input the visual images of written words into working memory in such a way that visual units correspond with phonological units. We also then have expressive orthographic coding. This is when the orthographic loop coordinates recall of orthographic codes in working memory with external output through the hand. This supports the integration of reading and spelling written words. A person who has orthographic difficulties usually has difficulties with spelling and or writing, a term which Dr. Berninger refers to as dysgraphia. The second level of this model is for children who have difficulties with both orthographics and phonology. These children are usually referred to as being dyslexic and present with difficulties with word attack and spelling skills. It must be noted that if you have a diagnosis of dyslexia tier 2, it means it is also very likely that you may have a difficulty with the tier below, i.e. dysgraphia. However, if you have dysgraphia, i.e. tier 1, it does not necessarily mean that you will have difficulties at the next level, i.e. dyslexia. The third tier of this model she refers to as the orthographic, phonological, morphological route. These are children who have oral and written language learning disability, or the terminology we might see here is developmental language disorder. These children tend to have difficulties with reading, spelling, and written expression. Once again, if a child is found to have difficulties at tier 3, that is the orthographic, phonological, and morphological level, they are likely or could have difficulties at both the dyslexia level and the dysgraphia level. However, if a child is found to only have difficulties with orthographics, they are not likely to have dyslexia and or developmental language disorder. We all see words somewhat better when presented on our right. Presenting letters and words on the right-hand side is thought to facilitate orthographic processing. So what are some of the signs you might see in the classroom that may make you consider whether the child is having difficulties with handwriting? In lower primary school, the child tends to avoid writing tasks despite being good at reading. Their letters are poorly formed, they have poor spelling, and their handwriting shows poor spacing and sizing of letters and words. In the later years of primary school, writing tends to be slow and disfluent. The process of writing is often effortful and tiring, and handwriting is considered to be immature for their age. There tends to be a significant discrepancy between their verbal ability and their written skills. In secondary school, legibility of handwriting tends to be poor. They have difficulties writing at the same speed as their peers and have great challenges in transferring their thoughts into written words. There is a lack of detail in their written expression. Their writing and spelling skills do not appear to be automatic. We must consider the developmental stages of handwriting when we're talking about specific difficulties in relation to handwriting. Learning how to write is a long and demanding process that starts as early as 2 years of age and ends in late adolescence. The biggest changes occur between 5 and 10 years. Letter formation tends to start at 5 and 6 years, with speed and fluency coming to the fore at 8 and 9 years. The number of words per minute has been found to predict compositional quality in both typically and atypically developing children. Some researchers have found that automaticity in handwriting is achieved by 8 to 9 years, with others feeling that only at 10 to 11 years does letter production become more automised, fast and less variable. Either way, we don't achieve mature writing speed until 15 years of age. Studies of individual profiles of dysgraphia are urgently needed. Still, too little is known about dysgraphia with respect to other cognitive, sensory or motor domains.